Thank you for joining us for this very special event, Achieving Drug Policy Reform Lessons from COVID-19, a conversation with the Global Commission on Drug Policy. Welcome to beautiful Canberra, which is the home of Federal Parliament in Australia. The Global Commission on Drug Policy is a panel of world leaders and intellectuals. The Commission aims to bring to the international level informed, science-based discussions about humane and effective ways to reduce harms caused by drugs to individuals and to societies. This evening we will be joined in conversation by Commissioners Helen, former Prime Minister of New Zealand and former Administrator of the United Nations Development Programme, and the Commission's newest Commissioner, Geoff Gallop, former Premier of Western Australia. Australia is considered a global leader when it comes to its COVID-19 public health response. We put to you that there were 4 key things that Australia has done that have been true in making COVID-19 the success it has been. We have prioritised public health, we've listened and acted on evidence, we have worked with the most vulnerable, and we've mobilised political will and we have engaged the community. These are important questions for drug policy, so we ask you to keep these in mind tonight. How can we prioritise public health and people who are most vulnerable? How can we listen and act on the evidence? And how can we mobilise political will and communities? To formally begin the event, we are very pleased to have Indigenous leader Selina Walker welcome us to Ngunnawal land which was never ceded. I would like to acknowledge the grassroots global and Australian movements against racism. In Australia, Indigenous peoples have been particularly calling for reforms to the criminal justice system, and this will be part of our discussion this evening. Please welcome Selina.
My name's Selina Walker and I'm a traditional Ngunnawal woman from Canberra, ACT. I'd like to start by acknowledging any other Aboriginal and Torres Strait Islander people that are with us. Welcome my brothers, sisters, aunts and uncles. I'd like to extend that to all our non-Indigenous friends that have joined us both nationally and internationally. The Ngunnawal community are the traditional custodians of Canberra and the region. You may not be aware that the Ngunnawal nation is made up of several family groups and not just individuals who represent this country. Therefore, as a community, we have an elected body known as the United Ngunnawal Elders Council to represent us, along with the Aboriginal and Torres Strait Islander elected body of the ACT. This is important for you to understand and acknowledge, for our identity is a collective identity. There are other Indigenous and non-Indigenous people from around the nation, the country and the world who have come to live on Ngunnawal land. I would like to acknowledge and welcome you all. The tradition of welcoming the people to country is a practice that was handed down by our ancestors, old people and elders from the beginning of time. Before entering another person's country, you would first announce your arrival and not enter until a traditional owner formally welcomed you. The reason for this practice was to protect your spirit whilst in another person's country and also to show respect for the country which you were entering. It's wonderful to see that this practice is now recognised and respected. I suppose it's not like entering into someone's home unless you're first invited. The Ngunnawal people, as within all Aboriginal people, have a great heritage that we would like to share with all Australians from every walk of life. As you are aware, Canberra means meeting place, and Canberra has been a place of gathering for many Aboriginal tribes of Australia to come together to deal with important business and also for ceremonial purposes. Our Ngunnawal ancestors believe the importance of people gathering to build relationships, share knowledge and to celebrate the gift of heritage and history. We believe it's important for all to recognise our unique history and to gain an understanding that our land is our heritage and how lost land has disconnected so many Aboriginal people from their spiritual links, cultural heritage and identity. So on behalf of the Ngunnawal people, I'd like to thank you for inviting me to do your Welcome to Country. I have worked in the community for over 15 years and this is something that I'm very passionate about, so I'd like to thank the organisers, thank the Commission and everyone that has joined in. Thank you, and I'll now finish in the words of my people, the Ngunnawal people. Yumalandi Yananga Yerebu Yangu, which means you may leave footprints on our land now, or in other words, welcome to country. Thank you very much.
Thank you very much, Selina. I'd like to welcome everybody to this very important event. Before we bring the 2 commissioners in, I'm aware that we've got a very broad audience for this event, and so I wanted to set the scene a little bit about drugs and drug use in Australia. Around 9 million Australians have used an illicit drug at some point in their lives. That's about 37% of the Australian population. And people use illicit drugs for all sorts of reasons. They use them for pleasure. They use them in order to self-medicate and manage stress. They use them to enhance their experiences, whether that's physically or spiritually or emotionally. And some people use drugs because they become dependent or addicted on drugs. Becoming dependent or addicted on drugs doesn't happen to everybody who uses drugs. In fact, it only happens to a minority. So we know in relation to cannabis, for example, that of all of the people who have used cannabis at some point, 9% of them become dependent on cannabis. The figure for heroin is higher, but it's still 23%. So a quarter of the people who have used heroin become dependent on heroin. Those people who do become dependent, it can seriously affect their well-being, their health, their relationships with family and with friends. The good news is that treatment works. People who receive treatment for their drug dependence can resolve their problems and continue living a healthy and happy life. The problem in Australia is we simply don't have enough treatment. We only treat half the number of people who are seeking treatment in any 1 year. What do we do instead in Australia? Well, largely we arrest them. Last year, there are 134,000 people who were arrested for drug use. There were 14,000 people arrested for drug supply. What that means is 90% of all of the drug arrests in Australia were for drug use, not for drug supply. Arresting someone for drug use is not an effective response. Hopefully that's given you some idea of some of the basic facts about drugs and drug use in Australia. I'm absolutely delighted to have Commissioner Helen Clark and Commissioner Geoff Gallop here with us to reflect on their experiences, to give us some of their wisdom, and in the context of COVID-19, to reflect on what we can learn from the COVID-19 experiences that we can apply to drugs and drug policy in Australia. So, starting with the state of play, how do you think Australia stands in terms of drug policy relative to other countries around the world? Commissioner Clark, if you'd like to comment.
Well, thank you, Alison, and great to be doing this event for an Australian audience. Obviously, I'm not Australian, but Australia is the closest neighbour of New Zealand, and we always look with a lot of interest at what the trends in public policy are. So I think in the first place, you would say that Australia stands pretty much in the mainstream of prohibitionist countries in its approach to people who use drugs. But if we reflect for one moment on the figures you just presented us with, 9 million Australians have at some time consumed an illegal drug. That's almost 40% of Australians. Now, seriously, 40% of Australians, most of whom do not want to be among that 134,000 people who are picked up and arrested on drug use and convicted a year. So there's a complete disconnect, isn't there? 40% are doing something that the state says is illegal, and each one of them is vulnerable. A very tiny proportion are prosecuted, but that could be my child, my grandchild, your grandchild, whose life's prospects are blighted having had a criminal record. And if there's any reason I'm passionate about drug law reform, it's really tackling this head on. Prohibition doesn't work, it's widely ignored, and we need to deal with these issues in different ways. So with respect to Australia, if I start with a positive, it has been one of the most vocal countries at the World Health Assembly on the critical importance of ensuring access to essential controlled medicines for people who need them. And these medicines, which are controlled also as illegal drugs, are very necessary for pain relief. Think of morphine, for example. I have an elderly father with chronic back pain. You escalate up to some quite heavy drugs. People need access for pain relief, for their palliative care, and for anesthesia. But it's interesting to me that high-income countries like New Zealand and Australia, as a group, consume 75% or 3/4 of the accessible controlled medicines in the world.
Yeah.
Now, of course, the high-income countries are a tiny proportion of the world's total population. So that tells us that around our world, there's huge inequity in access for people. And one suggestion I might make for Australia to consider is Australia is very rightly proud of its aid program. You know, building the technical capacity for other countries to be able to access medicines of these kinds for their people, for the purposes that we use them, I think would be a very worthy follow-on to Australia being a strong advocate of access for these users. Now, let's then come to the issue of the drugs which are classified as illegal in Australia, New Zealand. It's the long list of countries, apart from the most enlightened. And we now see ACT going one better with the legalisation, and obviously we watch how that's playing out with great interest. Now, I think with respect to the drugs currently classified as illegal, as you said in your introduction, Alison, the level of problematic use of drugs which are classified as illegal is actually exceptionally small. The vast majority of people who use a drug which is classified as illegal do it in a manner they control, as many would have a glass of wine or a beer with their friends. So yes, for the small proportion for which there is problematic use, options for access to treatment are extremely important. What we would stress at the Global Commission is the importance of those treatment options being worked through between the person seeking the treatment of their own free will and their medical advisor. We don't think that authorities should ever have a right to impose a model of treatment. Authorities should be able to see a large range of treatment options available. And you know, we're all familiar with this. I think back 30 years to when I was a New Zealand Minister of Health, and the term used to be methadone maintenance. You got on that program. These things have been around a long time. So the key thing is for the person who is seeking the treatment to have some autonomy and choice in consultation with their physician on how to handle these issues. So I think, overall on illegal drugs, as a commission, our advocacy is to tackle head on the prohibitionist approach. We see it as counterproductive. We see it as it actually inhibiting people, standing in the way of people seeking support they may want to seek when they seek it. And we call for open evidence-based debates about the problem that prohibition has caused our societies. And I'll elaborate as we go along in this session a little more about the negative effects of prohibition and how we could address that.
That's great. Thank you very much. Commissioner Gallop, how do you think Australia stands in terms of drug policy compared to other nations?
Well, I think it's interesting to look at the spectrum that exists in relationship to drug policy. At one end you have the very, very heavily prohibitionist approach, and we've seen the tragic consequences of that in some parts of Latin America and in some parts of Southeast Asia, where the human rights of drug users are totally ignored to the point at which there's state authorised killing of them, through to a legalisation and regulation type approach, which the Global Commission would favour to try to achieve a number of objectives, to cut down on the power of the criminal groups that are there, but also to create a much better environment for people and for society generally according to the human rights and the health and well-being of people. Australia's sort of in the middle. It's still got a prohibitionist framework, as Helen said, but it's added to that some harm reduction initiatives and in some ways some decriminalisation in respect of marijuana. So it tends to be in the middle. It's certainly not yet pushing in the direction of some of the major changes that have occurred in America with regard to cannabis, for example. The Australian Capital Territory are completely decriminalising marijuana, but they're not really going down the track of having a new system of regulation and legalisation. So we're sort of sitting in the middle. I think the politics of it, though, have been that those favouring change in what we would regard as a positive direction, in other words, removing some of the worst parts of prohibition, adding some harm reduction initiatives and some public health initiatives to the equation, they've tended to be winning the argument within the community. But they're heavily opposed. I mean, there are very strong interest groups opposed to any change, and each time there is a change, they say it's going to lead to the downfall of Western civilization, but each time it happens, we see good benefits come through. So you've got drug reformers and people interested in welfare and human rights making the argument. On the other side, you have strong resistance to it. And then, of course, there's the general public. Now, there's been work done at the University of New South Wales by people such as Alison. My judgment call about the general public is that, they're very open to change. They're open to have change in this area in a positive direction, but they're cautious. They haven't been completely convinced yet that we need to go even down, say, a Portuguese path, let alone down a legalisation and full regulation path. But they have an open mind about these issues. So I think that's where Australia lies generally in relation to the big themes of drug policy. Different states have been doing different things. For example, in the harm reduction area, you've got the injecting centre in Sydney, and now there's an injecting centre in Melbourne. You've had the methadone program for some time, needle and syringe programs. It's possible in the marijuana front to have different approaches in different states, and that's happened. And these are all important because when one state does it, there's an example there. The evidence then can be assessed, and the argument can be had, I think, on a much better way for those who want change, because the evidence consistently comes forward to say that these initiatives pushing us towards a reform of our laws create a better outcome for the broader community. So I think I'd say Australia's in the middle. The trend has been towards change, but recently, we haven't perhaps been doing as much as we've been doing in the past, the exception being Victorian Injecting Centre and the ACT radical decriminalisation that they've introduced there. There's a debate about pill testing going on. There's a debate about diversion. There's the ongoing discussion about police cautioning rather than sending people off straight into the criminal system. My final point is on that very issue of policing. Now, Black Lives Matters, it's being debated and discussed in Australia at the moment, as it indeed is across many, many countries. And the story here is not a good one. About 80% of Aboriginal people in Australia who are apprehended with small quantities of cannabis are pushed into the criminal system. 50% of non-Indigenous go into that system. In other words, the general trend, which has been towards more cautioning, diversion, etc., there's clearly a racial dimension to the way that is being administered. And I think that indicates that when you have an undercurrent there of racial discrimination, and you have bad policies such as the ones that are not clear in relation to our drug use, you can get some very bad outcomes for marginalised and vulnerable people.
Yeah, thank you so much, Geoff. I think Carrie's going to pick up on the issue of the ACT and cannabis.
Yes, so I guess reflecting on the opportunities that jurisdictions and localised responses can do, as you were saying, Geoff, in terms of states and territories being able to go in different directions and the potential strengths of that. There's also, I guess, me being in Canberra myself, the city-state, the opportunities for cities themselves to lead, which is also what we've seen in terms of some reforms such as injecting centres in Melbourne. It's very much a kind of city-led type of initiative to respond to localised problems. And so we do have these little kind of pockets of movement. But in terms of big reforms, a lot of the reforms we've done are quite old. You know, they're kind of 30 years old. And the changes to the cannabis laws, some are calling it decriminalisation extended. We're calling it partial legalisation because for people that use, cultivate, and for that is legal. It's just we haven't quite dealt with the supply side. That seems to be too difficult right now. So I guess my question is, how might we be able to accelerate the pace of reform? How can we get that moving more quickly? And Commissioner Clark, maybe I can have some of your reflections on that.
Well, I'll build on what you've just introduced, Carrie, and also what Geoff said. It's right that in New Zealand and Australia, we've had very little innovation at a national level or federal level in your case for a long time. And let's think back to what brought about the innovation before. A lot of it, like the public needle exchange schemes, came out of having to address HIV. And clearly, you know, there were three key populations. One, men having sex with men. Second, the sex worker population. The third was people who inject drugs. And as a very pragmatic response to stop that AIDS epidemic in its tracks, your country, my country, many Western countries brought in the needle exchange schemes. But then in New Zealand, we just kind of sat on our hands after that for the next, you know, pretty much until last year, when we began to get some law reform. And I should say, in New Zealand last year, there was a Misuse of Drugs Amendment Act passed, which gives the police a direction in law not to arrest and prosecute for personal use and possession, unless, quote, it is in the public interest to do so, which frankly it very seldom is, if ever. Now, I'm still waiting to see when we begin to get some reporting as to whether the police have changed their behaviour accordingly, but a direction in law is reasonably strong. But we have had less innovation than you have had on the safe consumption spaces. We don't have any. You at least have them in Sydney and in Melbourne. On the other hand, we've had the police, by and large, turn a blind eye to drug testing. And I know there's been quite a debate on this in Australia. In New Zealand, when the issue came up before last Christmas, both the Minister of Police and the opposition spokesperson said they thought testing was a good thing. So I'm seeing perhaps a little bit more pragmatism here now. But you know, if Australia innovates, New Zealand will leverage off that. If we innovate, hopefully you'll leverage off that either at state or federal level. So, you know, we could be playing catch up with each other on good policy if we get this right. Now, on how to accelerate reform, it strikes me at the moment that your country, my country, we have dug so deep for the COVID-19 pandemic. I mean, we have deficits that governments would have thought in any other times would be completely insane, and we've had to do it, you know, to protect our people's jobs and livelihoods and health and so on. But the government's going to be looking to save some money. Have we got news for them? The savings that could be made in policing, in prosecution, in court costs, and then in prisons from dropping the prohibitionist approach to drugs would of course be absolutely huge. Very significant amounts of our prison populations are people who have been convicted on drug offences. So if there's ever a time to be pushing on cost-effective policy and saying prohibition fails every test, this is it. And isn't it interesting that when in some countries they were very concerned that COVID-19 might get into the prisons, they decided to let the low-risk prisoners go, which raises the issue of why they were ever there. But a lot of those low risk are the people who were in there because they were consuming a drug that was deemed to be illegal. Now, a second point I want to make, which I think should really appeal to anyone who has a concern about fairness and justice in our communities. The way the drug laws are enforced in your country, in my country, in the US, the UK, the list is long, is discriminatory. It's discriminatory against ethnic minorities, including Indigenous people in your country and mine, and it's discriminatory against young people. The drug laws are something you can throw at people when you want to pick them up for suspicion of something else. It's been the easy way to get an arrest and to get warrants for entering and so on. It's very, very discriminating. And it does sit in that pantheon of issues around racial injustice in law and order systems. Of course, in many countries, the prohibitionist approach taken to an extreme results in shocking human rights abuses. And I'm thinking of the extrajudicial killings that we've seen unleashed on the users and small-time sellers of drugs classed as illegal in, say, the Philippines. Another reason I advance for actually getting a grip on the responsible regulation of drugs is that why would you leave a trade like this in the hands of criminals? It's a gift to criminal organizations to have drugs as illegal. And if countries are serious about cracking down on organized crime, why not take away one of their biggest sources of revenue? Why not start to attack them where it hurts, which is their profits, by taking control of the drugs in the community with regulation. Throughout human history, human beings have looked to some substance or another to give them some kind of experience, whether it's pain relief, whether it's pleasure, whether it soothes anxiety, whatever it is, we've looked for it as human beings. Now, in modern times, we regulate around the effects of those substances. We regulate heavily around tobacco in Australia and New Zealand. We regulate around alcohol. It is an accident of history that these drugs are legal, and the drugs classed as illegal are classed that way. And there is a basic unfairness in the users of some substances being dubbed as criminal for what they do, and others not at all. So I think there's just many arguments now for accelerating the pace. And I say, with respect to the pandemic, governments are looking to save some money. We've got good news for them, and we have obviously some very good examples of how to be pragmatic on the drug use issues, with our needle exchanges, with our opioid substitution therapies like the methadone maintenance, like the safe consumption spaces that you have, like the drug testing. We just need to be much more pragmatic in the way we deal with the issue of drug use in our societies.
Thank you. And Commissioner Gallop, can I invite you to share some of your reflections on how we might be able to accelerate the pace of change?
Well, Helen has reminded me of this, the budget question, which we should always think about, because clearly, it's important that money be spent on education and health, etc., to have a good society. And when you're spending a lot of money on incarceration, there's some doubt about whether you're getting value from it, particularly when the people you're incarcerating really ought not to be in prison, given the nature of the offences that you've defined. I remember very well in the early days of my own government when the Attorney General and the Minister for Prisons came into the Cabinet and said, look, I've got a proposal here that, along with the decriminalisation of marijuana, we're going to get rid of a whole lot of these minor offences. And guess what? We're going to reduce our prison population. And secondly, we're going to close down a prison. So we actually closed down one of our prisons. And the Treasurer was very happy about this because of the extra money that was available to do other things. So Helen's reminded us of this, as indeed have some American states that have gone down the legalisation and regulation path and have produced good revenue for the government, as has happened in the tobacco and alcohol area as well. This is a tricky issue in terms of politics that you've raised. How do you get the political class to take up substantive reform? Because we've come so far down the track, we now realise we need to go further if we're going to get better results. Decriminalisation through to legalisation and proper regulation. How you think about a politician he or she's getting a lot of information in about whether or not a particular policy will produce certain results. All of our researchers out there, such as Alison and others, are throwing in arguments. Look, if you do X, Y, Z will happen. And, you need to know also that B might happen as well. So we get the researchers giving you evidence about what works and what doesn't. And we know that harm reduction, decriminalisation, legalisation and regulation can really improve the situation. Then you've got the feasibility issue. It's one thing to have a policy, you've got to be able to implement it. And this is the big issue that Helen alluded to earlier, and I would say as well, when you say you want the police to be more cautious in the way that they approach people who use drugs, they've got to make a judgment call about these things. They need to be educated. And the whole issue, of course, about racism as well comes up into that context. So it's got to be feasible as a policy, given the resources you've got. But finally, the third one is it's got to be acceptable. And that means, politicians are always looking at that thing called public opinion. And public opinion is influenced by lots of factors. But if you can get a policy that's highly suitable, it can be shown to produce the right results, it's feasible and also acceptable, then, you're really on the path. I'm reminded of Lyndon B. Johnson, the great American reforming president, who was brought down ultimately by getting bogged down in the Vietnam War, but was a great civil rights and rights president. He was visited by many in the feminist movement, and they wanted him to speed up, just like the question I got, speed up reform. And he said to the people he met, you go out there, you go and make me do this, create a movement so I have to do it. And I guess that's the conclusion I would reach here as well, that if we're going to get that public opinion, we need intellectuals and moral leaders that point out that the fundamentalism of prohibition doesn't work. Not only doesn't it work, it exacerbates the situation. We need, of course, also a lot of the people that are users of drugs to show to the rest of the community what it means to be in that position, what the stigma means, how hard it is for a lot of those people to seek treatment that they need. And because of the stigma, the treatment may not be there. And the Uniting Church Fair Treatment campaign has made this point. It's very easy for politicians to say, we need to forget about legalising drugs or decriminalising drug use, forget about all of that. We want to treat people. Well, it just so happens that there isn't enough treatment available of the right sort in any case to do that. So I think you need that personal experience so people can understand, how serious and difficult it is for those people who use drugs. Many use drugs without these problems, but some use drugs and they become dependent. It's causing issues for their life. It's making them do things that they know are bad and they need help. And so you need that message out there. Also, very importantly, I think you need your supporters in the parliaments and having parliamentary groups around Australia that support drug law reform, very, very important part of the equation. So we can mount lots of arguments, and I think we've got very good arguments when it comes to evidence. What we need to back it up when we talk to the politicians is, look, public opinion, which, as I said, currently is on side for change, but it's cautious, and we've just got to get them over the line. And that needs a proper movement to do it. It's happened in many areas of public policy. And who would have thought 1 decade ago that we would have had marriage equality in Australia? These things happen. And that happened because of a very strong movement, articulated its points very clearly, won support within the parliament, took a bipartisan approach, got both sides in favour, and the measure went through.
One of the things that I guess was highlighted then in some of the comments was a little bit about, how do we take advantage of different contexts? How do we take advantage of a crisis? And one of the things that I guess we're thinking about today is COVID-19 and drug law reform. And so both Australia and New Zealand are really considered as global leaders in terms of the public health, in particular response to COVID. And there's been a few real ingredients to that success. And one has been about what Commissioner Gallop was just speaking to in terms of community mobilisation, most definitely. And another was definitely about prioritising public health. And so I guess this is in stark contrast to a lot of what the commissioners have been saying, where traditionally in drug policy, we prioritise law enforcement. And in Australia, we have this challenge where we have sometimes a public rhetoric And we have had heads of the police say things like, we can't police our way out of drug use, but we don't see the action, I guess. We don't see it in our budgets, we don't see it in our data, we don't see it in our arrests. And so I guess thinking about COVID and some of the successes of COVID, to reflect on how might we be able to prioritise the public health response in terms of drugs. Commissioner Clark, do you have any thoughts on that?
It's interesting, isn't it, that there's no way you can hospitalise your way out of the pandemic. You have to get in there and try to stop transmission, because that virus will keep going as long as it can find a host that will receive it, and that host is us. So getting an engaged public on board has been extremely important. And yes, I too hear the police who say, we can't police our way out of drug use to a nirvana of no one anywhere ever using a drug. This is not real life at all. I had the experience a couple of years ago of meeting a wonderful member of the Canadian Parliament who was the Undersecretary charged with seeing through cannabis legalisation in the Canadian Parliament. And he had been the Toronto police chief. He'd been an undercover cop in his career. And he said, Helen, I can tell you what doesn't work. Everything we used to try to do. It didn't work. And I'm proud to be part of an effort in this government to legalise cannabis and start a common sense approach to this. So in terms of prioritising the public health response, if we talk about prevention, that's quite a tricky issue. I would prefer, I think, to talk about a level of raising community awareness about what the real issues are. As we do with tobacco, we don't ban people using tobacco, but we make sure that every time they pick up a packet, they're faced with a warning that tells the truth about it. To some extent, we do the same with alcohol. We regulate around it. So it seems to me that if you can bring this discussion in from the shadows, if you can make it clear that the use of a drug is not in itself a reason for someone to be pursued by the force of the law, then you can start a real conversation about what people are doing. I mean, cannabis on the weighted ratio of risks comes in as rather less helpful, rather less harmful to human health and society than either tobacco or alcohol. But that's not to say there aren't risks. And so we need to put those on the table so that people are informed about what those issues are. Secondly, I think that also entails information about avoiding dependence. There is there are sort of layers of use. We know problematic use is relatively small, but to keep it small and reducing is desirable. And then, of course, there's what might be called a tertiary prevention, which is to support people who do have risky behaviours so that they don't end up in the course of that being affected by something else. And obviously the HIV transmission is an obvious aspect of that. You act on change policies because you don't want the consequences of injecting drug use to lead to transmission of HIV. In other areas of prioritising a public health response, well, definitely harm reduction. I mean, I cannot understand why anybody opposes harm reduction measures. The people who rail against drug testing at festivals, what do they want? Are kids buying stuff that's going to kill them? I'd rather, if they were going to buy it, and in my experience, the worst bit of public health advice you can ever give a young person is to say, don't do it, because they immediately want to do it. If they're going to buy stuff at a festival, I would much rather they lined up at the facility which tested their drugs, because I'd like them to walk home alive at the end of the festival. So we've talked quite a bit tonight about the harm reduction approaches, and I think that very consistent with public health prioritisation. I've mentioned the issue of treatment before. I think that there's no point telling a person who's using cannabis they need treatment. They'll say, well, if I need treatment, so does the tobacco smoker and, you know, the glass of wine a day person. This is not sensible. But clearly there are people who do seek to be free of dependence on a drug, and they need access to the wide range of options which may be able to support them at that time. But I think an overall point I want to make is you can't have an effective public health approach to the use of drugs without decriminalisation, because as long as something is illegal, that will always inhibit people seeking support, information, advice, whatever. I think back to the debate about homosexual law reform in New Zealand in the mid-1980s, because we were so late to change our law. And the reality was that with the HIV epidemic staring us in the face as a society, we could not deal with the risks of that if men having sex with men were deemed to be engaging in an illegal activity. And one of our first effective AIDS responses, alongside needle exchange and so on, was the decriminalisation of MSM. So I see that as just so basic to having public health prioritisation around the issues of drug use.
Thank you. And Commissioner Gallop, do you have some reflections you'd like to share, thinking of New Zealand and Australia's success in terms of the public health response to COVID, how we might be able to prioritise the public health response in terms of drugs?
I guess there were two parts to COVID that are quite relevant to our conversation tonight. And I mean, New Zealand obviously was a leader in the field, and Australia was not far behind in terms of effectively dealing with it as an island, as two island nations in those early years. The governments, for a change, allowed their public health officials to have a lot more influence on their decision making than they normally have. And they brought the evidence to the table, and the politicians listened to that evidence. Very, very important lesson. And we should use that into the other fields of public policy, such as drugs, and say that's what happens when you use evidence properly. You get good results. Science isn't just a little additional factor to human civilization. It's central to human civilization. And the second thing, of course, is important, not only in terms of the COVID, but let's say, go back to the way Australia tackled AIDS when it appeared on the horizon, appeared into the community. And that was engaging people, talking to people, getting them involved in the process. And in COVID, this has been a very difficult issue for governments, to try to get people to think about the way they're living their lives in the context of this virus that has appeared. Now, in terms of the drug issue, we need that engagement and we need that evidence. So I make that point. I think prioritising public health, we should point out that when we succeed, public health is always in there. What was the big factor that led to improvement in human life in the 20th century? Vaccination, public health initiatives, cleaning up the sewers, all of
clean water.
So that's the first point. The second point I would simply make is, I think, to look at the examples around Australia and internationally, and just explain to people that there will be a better outcome here. And that better outcome will mean less suffering in the community, less death in the community. And, there are not many human beings that aren't capable of listening to that type of story. And of course, the opponents of what we're talking about like to make out, that the people like Helen and myself and the Global Commission are all mad left-wingers, utopians, etc., trying to impose some radical ideology onto society. Well, the truth is, it's not that case at all. We're pragmatists. We're people who look at human nature and say, look, it would be wonderful to be able to change everyone and make them all perhaps not take any drugs at all, or not smoke any cigarettes, or not take any alcohol. But the fact is, human nature being what it was, the best strategy is to minimise the harm associated with that by engaging those people in the process. And I think that's a much better way of looking at it. None of this is easy. The politics are hard, but there's a good argument for it. And I think we need to be putting those good arguments and saying with pride that Australia at the time won a gold medal for the way that it treated HIV/AIDS. Why? Public health became important. People who use drugs weren't just treated as outcasts who you don't take any interest in. You involve them in their practices and their futures so that people stay alive. Very important points you can make.
That's great. Thank you so much. Just springboarding off some of those comments, in particular in relation to listening to the evidence. So it has definitely been a feature of both Australia and New Zealand's response to COVID. And as both of you have mentioned, evidence is fundamentally important. It's not the whole picture, but it's certainly part of the picture. One area where we are not implementing the evidence is in relation to prisons and needle and syringe programs. We know needle syringe programs work. We know prisons are a high-risk environment. We know our prisoners don't spend their entire lives in prison. In fact, the average sentence is around 6 months, so they're back in the community. And we also know that we should provide equivalent healthcare to every person, whether they're incarcerated or not. How do we get our government to listen to the evidence around placing needle syringe programs into prisons? Any advice from either of you?
Well, coming back on what Geoff and I have both been emphasising, New Zealand and Australia both have a reputation for being pretty pragmatic sort of countries. And I think we need to appeal to that pragmatism and looking at the evidence. I often say that good drug policy is counterintuitive because none of us are sitting here advocating drug use, right? We're saying drug use is a reality in our societies. So if our motivation is to increase health and happiness and well-being, we don't want people to be victims of policies that we put in place that are completely unrealistic. They pay no regard to the realities of life. And so that brings you to the prison environment. Now, there are drugs in prisons, right? If there are not needle exchange schemes, prisoners run the risk of contracting, whether it's HIV, whether it's hepatitis C, whatever, through the unclean needle use. So, of course, the evidence will point to dealing with reality. The same can be said about the availability of condoms in prison. Sex does happen in prisons. You want people to be able to protect themselves. So I just think if our philosophy is to preserve life and health in prisons, you're right. People should be offered the same options for healthcare and protecting health as they are offered outside of prison. People in prisons deserve to be protected, not to be exposed to more risk. That should be the pragmatic approach that we take.
Yeah.
Can I endorse all of the things that Helen has said there and add two more. I mean, one would be, and I'm being a bit of a politician now and answering another question, but it's connected, and that is, we want less people in prison who
yes.
And that first of all, a lot of people going into prison are going in there and they're minor drug offences, and they shouldn't be going into prison. So I think that's an important part of the answer to what you've asked. The other thing is, I think, and I'll be very narrowly political now, I think we have to target the people that represent that are the prison officers and their unions. We have to, they're the people we have to convince because clearly, they've expressed all sorts of fears and doubts about these issues, just as the general public does about drug decriminalisation. And we've got to win them over to the importance of a more pragmatic approach, as Helen said, that saves lives rather than takes a risk on lives. Indeed, on this very issue, I was very struck recently at a conference last year looking at this, and the man speaking pointed to the overdose deaths of people coming out of prison. This is we're talking life and death here now. A lot of people, they don't get the proper programs in prison. They come out, and as sure as we're sitting here, lots of them die. And that could be prevented if we had proper programs in the prisons.
Yeah. Thank you very much, Geoff. I'll hand back to Carrie.
Yes, so I guess as both of you have reflected with us, the Global Commission on Drug Policy has been really strong on its commitment in terms of centering people who use drugs and calling for them to be placed at the centre of policy development, policy implementation, policy evaluation, and the Commission, I guess, being concerned with those who are most harmed by drug policies, and including with the United Nations idea of leaving no one behind. And so a crucial aspect of Australia and New Zealand's response to COVID has been about considering the people who are most vulnerable and how do we connect with people who are most vulnerable in the response. In Australia, we've seen cases where people experiencing homelessness have been put up in hotels. We've seen things where people who use drugs have had their medicines delivered to their door. And I guess to connect some of this, we're really fortunate to have a short vignette from Geoff, who's a leader in the Australian drug user movement, to share with us some of his insights about the involvement of drug user organisations and people who use drugs in the COVID-19 response. So I'll invite you to watch this with us.
We formed as drug user organisations around HIV, and then over the last 20 or 30 years, in almost every jurisdiction in Australia, we've formalised our organisations as consumer organisations around people who use drug treatment services and people who are at risk of HIV and in particular hepatitis C. We work with one of the most highly criminalised parts of society, people who aren't used to being thought of as a worthwhile citizen, as playing a worthwhile part in society. And the response to both naloxone and the pharmacotherapy guidelines actually shows people that their life, their world, their healthcare, their opinion is important, that they're part of society, that people in government hear them, that people in health hear them, that they're friends, that the karma hears them, and so it juxtaposes what they usually feel. They usually feel they feel too internally stigmatized to complain when they get treated poorly in a healthcare service, to ask, why am I not able to access hepatitis C treatment from this walk-in centre? To a whole bunch of within society. We're talking about people who are constantly thought of as being the troublemaking criminals, and they think about themselves like that. One of the things that became really obvious when COVID-19 hit was that there was a response for people to socially distance, and that included a whole suite of strategies that were put in place for people to work from home, to communicate with their family, to communicate with their friends, to go and see their GP via telehealth. All sorts of wonderful things were happening. But what wasn't being discussed was how people on pharmacotherapy were going to access and keep themselves safe. What was different about this response in the COVID crisis was that things that, or what are usually the concerns of government when they're discussing drug policy, just melted away. Some of the, frankly, what I would call discrimination that people have, and I'm talking about people within these sectors have, that perhaps they don't realise, or maybe it's not discrimination, maybe it's a lack of understanding, or maybe it's just a point of view. But some of those issues simply didn't matter when you put the bigger and more important social health ramifications out there. The real impact comes from the empowerment of seeing somebody identify an issue and work with others in society to fix it, and then it comes back and there it all is fixed with all of these options for that person, and their health and well-being improves. The most important point that I would say is that this is a really good example of why it's important to have grassroots contact with people who are actually undergoing and living under the criminalisation of drugs, because it's very complicated on the ground. It often doesn't play out the way you think it's going to, and the best way to achieve results is to ensure that you have communication between the people who are experiencing the prohibition and on the ground, and that information about what those people are actually going through, their life experience, is being brought up, inserted in high-level policy, and then you'll get the policy right. And it's happening across the world in community groups, and feeding that into those high-level meetings, that you'll actually end up with workable policies going forward that matter on the ground and matter to the people whose lives are being destroyed by the prohibition of drug use.
I'd like to, really thank Chris and the Australian Drug Users Movement for engaging with us on this. And, one of the calls in there is, how can we better engage the people who are most affected in the work that happens in policy development and in action? And commissioners, I invite you to share your thoughts about how we can do this better.
What we saw was the human face of people who use drugs. These are human beings. It could be my brother, could be my nephew, could be my son. I think when people look at that video, they say, why are we doing this to people? How can we ensure that we really do leave no one behind, that we say, these people are us, and how do we then act in an inclusive way in society? How do we enable them to say what their needs and desires and hopes and wants are? So I thought the case was quite powerfully made for inclusion. Look, we've talked a bit about what we've learned these last few months with the COVID-19 response. Neither New Zealand nor Australia would be in the position we're in if we hadn't engaged our communities. It's our communities who got this result, who took the advice, who did the physical distance, who stayed home when they were asked to, who worked to take it into their own hands. We know from the HIV response that we got results when we worked with affected populations, key populations, including people who use drugs, to support them to come into the various needle exchange schemes, working with MSM, working with the sex workers, and then, of course, through the many parts of the world where it's a heterosexual epidemic, working with girls and women and boys, and really engaging communities. So why not on this issue? And the illegality is a major problem because it does inhibit people being brave enough to come forward, as our friend who appeared in the video did. But if we want an inclusive society, that society must create a space for the people who are using drugs to be able to be articulate, have voice, say what they need, and you know, how they want to interact and be part of policy and service design provision.
Thank you.
I endorse what Helen has said there, and would make two points about this issue of engaging with people who use drugs. The first one is, I think they need someone, and they need people who generally will be on their side. When it comes to advocating for particular issues, or when it comes to particular concerns they have, you know, they need people that are in a position to help them. Now, they may be people who are involved in state government or federal government service delivery in Australia. They may be officials, you know, medical officials that have to deal with vulnerable and marginalised populations. And it's important that we have those in place to assist the effectiveness that they have. And we need to be able to listen to the user community about their experiences of these treatment programs. I think we need to be on their side when it comes to information they provide and ideas they have and the experiences they have about the treatment programs that exist. The second thing I reckon is very, very important, that along the way comes issues such as in Australia in the last 12 months on something like pill testing. And I think we now know from looking at experience around the world that this can be a very effective way to save lives. And when that opportunity emerges, we've really got to go for it. Now, in the Global Commission, I suppose we've got, you know, the short term, the medium term, the long term. We know the big change that we want. But when these other ones come along, we've got to grab them and really give support to people who use drugs and enter into situations where their lives may be endangered, their health may be endangered. It's important that we're in there with them on those occasions.
Thanks very much, Geoff. You know, we've talked throughout about some of the parallels between what worked really well with the COVID response and what we could learn about that in relation to drug policy. We've just talked about the importance of community and having the community there and having the responses grounded and with them. The other feature of COVID in Australia was bipartisanship. Working at federal, state and local level together. There was an enormous amount of political will to make that work. So the final question we have for both of you is, what advice do you have for Australian decision makers about mobilising political will? What can our leaders do differently and better to make the kind of reforms that you've talked about a reality here in Australia?
Well, often in New Zealand, there's a Māori proverb quoted, and I don't have the fluency to say it to you in Māori, but it translates as, what is the most important thing in the world? It is people, it is people, it is people. And I think in mobilising political will, you have to bring it back to the human costs of the prohibitionist approach. I've talked about the economic costs, the money we literally pour down the drain on police, prosecutions, courts and prisons. Ridiculous. But let's come back to the human costs and ask, you know, any parent, any grandparent, any aunt and uncle, do you want your kids to be risking imprisonment, lifelong impact on career, ability to travel, even risking lives because they do things where they run the risk of incarceration, where if there are not harm reduction services, they may risk death by purchasing things which are unsafe and consuming them in unsafe ways. So in mobilising political will, I would bring it back to human beings. And would we rather have the responsible regulation of drugs than all the perverse effects we see from prohibition? Now, we see those perverse effects in Australian society and New Zealand society. In countries like Mexico, the attempt to enforce prohibition has led to an extraordinary acceleration in the murder rate. When I first was visiting Mexico as a private citizen going back 30 years, it was not a homicide capital of the world. You felt safe wandering around all over Mexico. Not today. The war on drugs has made it extremely dangerous. It's accelerated the homicide rate, the disappeared persons rate, the forced displacement rate as communities flee from gangsters who've taken over their communities, as the ante's been upped with the militarized response of government. This is not a future any of us want for our people. So I think governments have to take control of this issue and say what we've been doing isn't working. Australian politicians need to look at it and say 40% of our population has consumed an illegal drug. I mean, let's get real here. We don't want adverse consequences for 40% of the population. We want people to, have a good life here. And Australia has been the lucky country offering a good life to so many for so long. So in mobilizing political will, just call on that feeling for fellow human beings who could be caught up in something that has very adverse consequences for them because of criminalization and its consequences, and appeal to that traditional Aussie pragmatism. You can do it. If you're determined to do this, you'll do it, and you'll do it well, just like you play cricket well and rugby well and league well and everything well. You can do it. That's my message.
We've got a lot to learn from New Zealand, that's for sure. Thank you so much. Geoff, final comments on political will before we wrap it up.
Well, I'm going to Kev Carmody and Paul Kelly. From little things, big things grow.
Yes.
And I think that can be applied in terms of the little things that we can do to make lives less risky and less full of danger for those who use drugs. We can do that in terms of improving access to medicines, and that's an issue that Helen raised very early on in the program, proper medicine access. We can do that in terms of reducing the incarceration rate for people who are users of drugs. All of those little things are very, very important. And the little things we do by knocking on the door of our local Member of Parliament.
Yeah.
Every one of us has an obligation, knock on the door of the local Member of Parliament and explain why it is that we can create a better world if we go to legalisation and regulation, or even if we go to decriminalisation, such as in Portugal. The results there are very clear. The over-death deaths have gone right down. So all these little things will eventually add up.
Absolutely. Thank you so much. What's the most important thing in the world? It's people, people, people. And from little things, big things grow. What we've heard from the commissioners is that public health works. COVID-19 has had really important lessons for Australia. What we've seen is 4 features of the successful response to date to COVID: prioritising public health, listening and acting on the evidence, prioritising people who are most vulnerable, and mobilising political will and communities. The key question that we've posed to the commissioners is, how can we learn from those lessons for drug policy? And we've heard some really, really important messages. Firstly, prioritising public health. We heard that public health works: vaccines, safe water supply. But in order to prioritise public health, we need to remove the criminal penalties in relation to drug use. Secondly, we heard that we need to work with communities. Hearing from Chris, this is how we should be working with community. It is the community of people who use drugs that will achieve the public health outcomes in Australia. The third thing that's happened with COVID is that we've listened to the evidence. Politicians have had their chief health officers by their side. Why can't we do that in relation to drugs? The commissioners have emphasised that we have evidence. We have evidence in relation to needle and syringe programs, we have evidence in relation to treatment, and we have evidence in relation to interventions in prisons, in particular needle syringe programs in prisons. What's lacking is political will. The time is now. As one of the commissioners said, we need to grab the opportunities, never let a crisis go to waste. Governments are in deficit, and economically, we have the solutions for those deficits. We heard about opportunities that we needed to grab and run with, for example, in relation to pill testing. We heard that governments are in trouble economically, and we know how they can save money. We know the policies in drugs that will help, that will make a difference in people's lives, people who use drugs, and that will help the economic circumstances that governments find themselves in. All we need is for politicians to do the right thing. Thank you both very, very much. We very much appreciate it.
Thank you.
Thank you.
Thank you.